Hello aspirants, welcome to PW OnlyIAS English channel. I'm here again with the daily current affairs for 10th of September 2024. Let's analyze the Hindu and see the various intricacies and articles that are important with respect to the civil services examination. Today the various topics that we have taken are the uncommon cyclone in the Arabian Sea GS3, the MSME with respect to GS3 again, Swiss peace process, the editorial which deals with the regulatory reforms which are stuck. It is again with respect to the health sector. Opinion with respect to the malnourishment. These are very important topics. We're going to discuss them one by one. Let's start. The first article that mentions over here is the MSME faces fresh headwinds on the new machine safety norms. Now, as a candidate who is reading this article, it is very important for you to understand what MSME is, first of all. Then, what are the certain regulatory issues that are there? Because see, we don't have to go into the R&D, but we need to know what are certain issues that are prevailing. Because if the topic, either in the preliminary or let us say in the mains examination, comes with the challenges related to the MSME sector, then you have a point which you can write that these are various dimensions with respect to the safety norms that can be added that might impact the MSME sector as a whole. We'll see the various dimensions associated with the MSME sector. Let's understand what the basic issue over here is. See, the new norms, now what the new norms are doing are, they 3 levels of stringent safety standards for the machines and electric equipment have been brought into force. Now, these stringent norms are creating a lot of issue for the MSME sector. How? The equipments, that is the electrical equipments and the machines, the electrical equipment and the machines that are made in India or imported into India will be subject to these stringent norms, that is the quality standards, while the export-oriented items have been exempted from them to a certain extent. Now, what happens is this is creating a disparity. Now, the MSME sector wants that this disparity should not be there. So, this is something of a discussion mode. More and more articles will be coming, and I think in a day or two, you will be having certain editorials also in MSME. So, we'll be discussing these issues and the stringent norms in details in the coming articles also. So, these stringent norms coming and being imposed on the equipments, machine and the electrical equipments made or imported into India, while the export-oriented items have been exempted that come under the mandate of the Bureau of Indian Standards. So, when you see this disparity between two sets of entities, then automatically the issues will come. Now, this is something that you need to know with respect to what? The problem that is there. That is one angle. The other dimension that you need to know is what MSME is. Now, knowing that is important because you can be asked a question of what MSME is in your preliminary also and in your mains examination also. So, this is one thing that is written in the article. Now, remember, in this particular article, there is a organization that has been used. The term or the word has been used. That is Global Trade Research Initiative. Now, it is like an organization or a forum. Now, in your preliminary examination, you can be asked with respect to GTRI, consider the following statements. Now, in that particular case, you need to know what this particular thing is because it is mentioned in the article. Now, what GTRI is? It is a research group. It is a research group focused on climate change, technology and trade. Now, in your preliminary examination, you can very well know what are the core areas of study with respect to the GTRI. So, these things are very important: technology, trade and climate change. Now, what GTRI aims at? GTRI aims to create high quality, jargon-free output for the government and industry from the perspective of development and poverty reduction. That means it gives suggestions, it gives analysis, it gives research outputs to the government as an advisory, as a suggestive body, what things can be done, and a long term which aims at the development and poverty reduction. Now, why poverty reduction over here is important is, remember, the moment you hit GTRI and the UPSC gives you various points, consider the following statements with respect to GTRI. They can be having, let us say, climate change, trade, technology and poverty reduction. what comes into our mind is, how can poverty reduction be related to this particular topic? That is why knowing the details about these bodies also become very important. When we come to the article again, when we see the MSME facing problems, something that you learned is related to what the issue is into consideration right now. There will be more articles on them. We will do it in detail. Now over here, this analysis or the view has been given by GTRI. So again, we need to know GTRI. Next is little bit about what the MSME is. The new definitions are also there by Government of India. How do you classify or define the MSME sector? See, the parameters are either investment in the plant and machinery or the annual turnover of any enterprise will be micro if it is less than equal to 1 crore, or the annual turnover is less than equal to 5 crores. It will be small if the investment in plant and machinery is less than equal to 10 crores, or the annual turnover is less than equal to 50 crores. In case of medium, it is less than equal to 50 crores and less than equal to 250 crores. Now, this is the definition of the micro enterprises, the small enterprises and the medium enterprises, which you should know, because you can be very well asked in your preliminary examination as well as your mains examination. Now, why MSME is repeatedly mentioned? Please understand, MSME sector is very, very important for the India as a whole's not only contribution to the economy, but also large employment opportunities. Let us see a few importance aspect. What is the importance? Please understand. The MSME sector contributes close to 30% to India's GDP. And that is a very big number. The proper nurturing of this sector, proper availability of schemes, removal of hindrances, that is why becomes very important. The coming of the stringent norms is good because you need to improve the quality standard, no issue. Taking into consideration the stakeholders and non-existence of disparity within the various sectors of this particular MSME sector is very, very important. That is why the article has come into consideration. We also see greater than 11 crore people are employed in the MSME sector. Now that itself is a very huge number. Another important thing is close to 45% contribution is made by the MSME sector to the total export that India does. Out of the total export, 45% is by the MSME sector. Now, these three facts or figures which you call themselves tell you the importance of this particular sector. That is why any hindrance, any problem in this sector will not only impact the GDP, will not only impact the employment aspects, but also the export. That is why clearing the issues or resolving the issues with respect to the norms or taking the stakeholders into consideration becomes very, very important, which you as aspirants should have a brief idea about. Now, let's move ahead to the other articles. Now, please understand, this was in the newspaper. The article came, Ukraine keen on India joining the Swiss peace process. Now, we all know the long conflict between Russia and Ukraine has been going on. Prime Minister's visit to Ukraine also was into talks. So, with that respect, the Swiss peace process has been into news for quite some time. You as aspirants need to know what this basically is, right? Now, what are the India's views? What are the India's stand? What this process is what you need to have a brief idea about. Now, let's see what this idea is and what are the various key points related to the Swiss peace process. Now, see, it refers to the diplomatic efforts aimed at resolving the ongoing conflict between Russia and Ukraine. Now, Switzerland maintains a neutral position. Once the country maintains a neutral position, it can act as a mediator between the two nations who are undergoing a conflict. That is why the word Swiss comes. Peace process, why? Because it is aiming at resolving the conflict that is going on between Russia and Ukraine. And this is basically a diplomatic effort which is aiming to resolve the conflict. All the activities under this basically come under the Swiss peace process. So it is being held. Again, Switzerland is a leading body because it is a neutral country with respect to the conflict that is taking place. So this is the Swiss peace process that is taking. Now let us understand the objective and various dimensions. As we've already told you in the first slide also, it aims to facilitate the dialogue, and negotiations aimed at resolving the war or the conflict between Russia and Ukraine. That is the main aim. That is why this dialogue or that diplomatic channel has been opened. Because see, unless and until diplomatic efforts are there, this will be a non-ending process, as it is lakhs and lakhs of people are dying because of this. So it is important that the issue is resolved. So this is a positive way forward. Now let us see what are the key points that one needs to know. Now see, various efforts with people are meeting. So there are certain key summits which you need to know. A significant event is the Bergenstock Summit, because this is one of the events where lot of decisions with respect to India also took place, India's stand also took place, and obviously how to proceed with respect to resolving the conflict between Russia and Ukraine was discussed. So this is one of the important summits that you should know with respect to the Swiss peace process. Key summit, you can remember that. Next is a focus area. Now the focus area itself is not simply resolving the issue prevailing between Russia and Ukraine. Merely the fight is not an issue, but you realize the moment the fight is going on, it leads to a lot of issues with respect to, let us say, food security, malnourishment people are having, the humanitarian crisis, the women trafficking that might be taking place, and the very important dimension that happens is nuclear safety. Now, the nuclear armed nations are one, because if a particular country, let us say, have nuclear arms, and the condition and it is subject to war, it is quite possible that even if the country is not using a nuclear weapon, it might come in the hands of certain people who might misuse it. That is why nuclear safety becomes very, very important. So when they are dealing with the topic of, when we are talking about the Swiss peace process, it is not merely resolution of the fight or the conflict that is going on. It also deals with the other allied areas that can be or have been impacted by the conflict. So the focus areas are quite wide. A humanitarian angle holds a major value over here. Next is the participants. The participants include approximately 80 countries, and various international organizations, international bodies are also a part of it. Now, what is India's position? As I told you about the summit, June 2024 summit, India has distant or disassociated itself, as that dialogue did not involve Russia. Now, the problematic situation that happens is that you are trying to resolve the conflict, and at that particular table where the discussion is taking place, Russia is not a part of it. How can you resolve the problem, or how can you have a dialogue? So India distanced itself from this. They said unless and until Russia is an integral part of this discussion, because you have to resolve the conflict between the two major nations along with the support of the other nations. So you need to have Russia on the table. That is why this is India's stand. That is why I mentioned the summit is very, very important with respect to 2024 summit, right? So India's position also changed when this scenario of non-participation of Russia on the table was an event that was a, let us say, a key point, turning point with respect to India's policy. India has had a policy where it wants negotiation, it wants resolution of conflict. But in that case, the key participants who are in the conflict should also be at the table, so that a comprehensive and a proper and a peaceful solution is there, which even the Swiss peace process is aiming at. So this was India's position. Now let's move ahead. See, now this is one of the very small articles. We will not go into the very depth of this, because we already study what are the various cyclones, what is the definition of cyclone. This article, when it came, it is one uncommon cyclone in the Arabian Sea. Now, please remember, the large number of cyclones that, or the climate change aspects, are basically impacting large number of cyclones that are impacting the Indian coastal regions as well as the interior regions. Now, this study came up with one of the aspects which says that the North Indian Ocean has 2 cyclone seasons. Now, this is something that was observed here. 2 cyclone seasons, that means we will be having repeated cyclonic seasons. That is why in other cases where cyclones originate, they generally have 1 cyclone season. On the other hand, the North Indian Ocean has 2 cyclone seasons. So there is greater tendency of having more number of cyclones, more cyclonic rainfall, and which adds to the monsoon rain also. That is why we see large number of cyclones that are hitting India. And this is one of the studies that came up. That is a limited thing that you should have a brief idea about. Now let's move ahead. Now comes to the very, very, very important part, that is the editorial. Now, what editorial over here is, please remember, today's editorial itself again repeats or deals with the aspect of the health sector. This is very important from the consideration, because when we are talking about health, it is not merely the absence of, let us say it is health of the people as such. No, it is also the back end things that are present, whether it is the rules, whether it is the laws, whether it is the organizations that are there. If they are not working properly, it will definitely impact the health of the people itself. Now, this article basically deals with the regulatory reforms that are stuck. Now, in this article, I'll give you a brief idea, because there are certain terms that have been used here. Let us say we deal with the aspect of, let's see, Central Drug Standard Organizations, Drug Controller General of India. Such names have been used. Now, as an aspirant who's preparing for civil services, it is very, very important that you should have a brief idea what these organizations are and how they are functioning. First, once you have understood that, then we will again come back to the article and understand because the article mentioned that there are certain policy initiatives that have been taken place. Now, those initiatives or the guidelines or the policies are not something that has come for the first time. They have been repeatedly coming up. That is why the 59th Parliamentary Standing Committee had also presented its reports on that. And this process of guidelines coming again and again is a normal practice. But they are not properly being implemented is what the concern is. Now, what standing committee or parliamentary standing committee are, you know that very well. In the yesterday's newspaper analysis, I dealt with the topic of parliamentary committees, where I told you about the standing committees as well as the ad hoc committees. So you very well know what these parliamentary committees are. Now, before I discuss the aspects of the regulatory reforms that are there, let me tell you or give you a brief idea. That is what we know as the back to basics concept. Please understand. There is an organization or a body that is a Central Drugs Standard Control Organization. Now, this is under the Ministry of Health. Now, what is its role? It is a national regulatory body for cosmetics, pharmaceuticals, and medical devices. Approval, giving standards, and having various by rules being passed under the Ministry of Health with respect to the cosmetic sector, the pharmaceutical sector, and the medical devices sector. So, this is a very, very important body. Now, this body is headed by the Drug Controller General of India. That means this particular organization is headed by the Drug Controller General of India. Now, these are something that you should have a brief idea. Now, there is one more word in the editorial that is used, which is Drugs Consultative Committee. You will be thinking what DCC is. This is referred to as DCC. Under the Cosmetics Act 1940, the central government has the power to form a committee which will be known as a drug consultative committee in order to advise the central government on certain issue that it wants to know or understand in detail. Again repeating, drugs consultative committee can be formed under the Cosmetics Act 1940, where the central government has the power to form a committee which will be known as a drugs consultative committee, which will be formed, which will help the government to understand certain aspect, or the committee can be formed to advise the central government. So that is DCC. So now you know 3 or 4 major things. First, Central Drug Standard and Control Organization, Ministry of Health, headed by Drug Controller General of India, then Drugs Consultative Committee. Clear? Now let's move ahead and understand what this basically the editorial is saying. In this part, they are basically mentioning that there are 3 policy initiatives that have come up over here. Along with mentioning the policy initiatives or the guidelines, this article over here is telling the various issues that are prevailing with respect to the guidelines that are there. So firstly, let us understand what the guidelines are. Let's see what is mentioned over here, this part. The policy or the initiatives, that is the guidelines that are basically released by the government. What are these? First, the recall guidelines. The recall guidelines. What are these guidelines? They're meant to quickly remove drugs which basically which fail the testing in the government laboratories in the market. For example, a drug is picked up and tested in the government laboratory and it fails to meet the quality standards, automatically it will be recalled. You will not be able to sell it and it will not be available in the market. So these are the recall guidelines that are present. Next, guidelines on good distribution practices. Now, please understand, there are various drugs or aspects related to the drugs which require a proper humidity level, proper temperature. It is very important. If they are not kept in that, the veracity or what the work of the drug is will fail in doing that. So that is why the correct storage and how it is transmitted or transported from the place it is basically manufactured to the various distributors or wholesalers, that also is very, very important. That is why the guidelines over here means meant to regulate how the drugs are stored and distributed during the transit and the sale. You will be seeing even during the COVID time also, there were issues when various vaccines are being discussed, which vaccine should be basically subjected to the patients. There were certain vaccines which we see that had to be stored at particular temperature, and also it was becoming very difficult for them to be to the patients because the reason it will increase the cost a lot. Similarly, with respect to various drugs also, you require specified temperature, specific humidity. And if they are not following that, then automatically the drug becomes a waste. It is being sold to the patient, but it will be ineffective. So that is why these guidelines become very, very important. Third, guidelines against confusing brand names aimed at prescription errors. What happens sometimes is that a certain drug has been prescribed. There are other companies who create similar drugs with almost a similar name in order to confuse the patients. And very often there is a nexus of the private sector, the drug companies and other people who help in doing this. So there are guidelines which are aimed at prevention of the confusing of the names. And what happens sometimes is that wrong medicines might be subjected to the patient that can aggravate the situation of the patients. So these guidelines basically try to protect the patients from any happening or mishaps of similar degree happening to the patients. So this is a very preventive aspects to prevent confusion of the names within the brands as well as the drugs. Now, these three policy guidelines have been there. Now, what is happening, please understand. Over here, these policy guidelines have been mentioned by the writers. When we move from this particular part, the 59th Parliamentary Standing Committee and other details, they say that, see, it is not that these guidelines have come up for the first time. They say even during the 1960s also, 70s also, 80s also, various reports and committees have come up which have suggested that these guidelines should be there. The guidelines used to come every time. Then again, after some time, they used to bring new guidelines. New guidelines used to come up. Now, what the writers over here is mentioning is that it is not merely the presence of the guidelines or the policy initiative. The problem is they are not being implemented properly. Now, with respect to these, there are various problems that are mentioned here. Now, I am showing you a chart where what the problems have been mentioned, which you as aspirants should know. We will deal with them. Let's see what are the problems. See, the problems mentioned in the editorial are, first, similar orders have been there earlier, but no proper implementation. Even the 59th Parliamentary Standing Committee report, even earlier reports during the 1960s also had presented with a similar view. The standing committee said that non-implementation at the ground level is a major problem with respect to this particular sector. Drugs and pharmaceuticals is a very major concern. Now, this has been mentioned earlier. We are in 2024. Similar issue is still there. Second, when we talk about DCGI, we basically, you will remember here, see, Drugs Controller General of India. When we are talking about DCGI, what was DCGI? Drugs Controller General of India, who is heading the Central Drug Standard Control Organization, right? Now, please understand, what is the issue? DCGI lacks the legal power to make rules. under the mandates and the function that have been given to DCGI, it can give you certain advisory aspects or let us say guidelines, but they will lack a legal power, which only the Ministry of Health has. Though it is under the Ministry of Health, but the order of DCGI will lack legal power according to the writer who is present here. So once DCGI has given given let us say an order, it goes to the Ministry of Health for proper approval. Once it is approved, only then it will have legal power. Simply DCGI giving an order might not have a force as that of the Ministry of Health, which is mentioned by the writer over here. So that means it leads to it being not properly enforced. So non-enforcement of this particular thing makes even the various guidelines that are released by them ineffective to a great degree. Now next is stakeholders meet and delay. What the writers in the editorial basically mention is that every time a guideline comes, before the guidelines, a lot of stakeholders are called to discuss and have meetings. So what can the guidelines be? Every time the similar guidelines come. The problem is that repeated stakeholder meeting and meetings and delays are going on. That is not what the issue over here is. But even after the meetings, you are not able to implement the guidelines properly on the ground is what the issue is. Similarly, before a guidelines is removed or let us say guidelines is released, the stakeholder will say there are certain issues. Then again delays would be there. And then again new stakeholder meet would be there. Then again delays would be there. So there is a repeated delay mechanism. And even when the guidelines come out, what we generally see? We see that they will not be implemented properly because the Ministry of Health at the, let us say, the secretary level are not approving it. It is simply by the order of DCGI. Clear? Next is at the last paragraph of the editorial, they have basically highlighted the issue with the All India service. This specifically mentioned the aspects of the secretary, joint secretary. What is happening is, you know that All India service is a very generalistic service. A person who, let us say, might have studied philosophy during his days, now let us say being in All India service, assumes a charge within the ministry or let us say DCGI charge. Now what is happening over there is that the person will lack, let us say, the specialization that is required. The authors or the writers over here mention that the joint secretary, the secretaries have a, let us say, tenure of 4 months. Certain guidelines are released. The new joint secretary comes in. They again see, analyze what the issues are, aspects. By that time, a new joint secretary comes. And again, there is delay. Lack of knowledge or specific knowledge with respect to this particular topic further aggravates the issue. That is one of the reasons for, we can say, red tapeism, delay, and non-implementation. So these are the 4 pillars of the problems that have been implemented. Now, what a suggestive effort would be? See, sometimes in places where very specialized specializations are required, okay, it is not necessary that all India service people might be the best fit. Even the people from the medical background can be put there in that positions. Administrators can be there, but again, we need to be very particular about the specialization aspect. This can be there. Next is DCGI, if passing certain order, it is very important the government should make sure that at the Ministry of Health level, the Secretary of level should again sign it and make it as a legal force that they are implemented properly. Next is that we see as a parliamentary standing committee had already 59th report has said that it is being mentioned repeatedly again and again. Thing is that it should be implemented properly. Have a discussion, it is fine, but on the ground it should be implemented so that the patients as a whole do not suffer because of these guidelines. Remember, if they're not implemented, it is not only the industry who's suffering, but it is the patients who will suffer very badly. Because let us say the quality of drugs might deteriorate if they are not transported in a proper way. Let us say they're not stored properly. Supposingly the third guideline might deal with, if they're not, the third guideline which I mentioned is not dealt with properly, you might get fake drugs. So these things need to be resolved. So this is what the editorial is all about. This is how you have to break down and analyze. See, there are certain things. When you read the editorial, you get to know so many things. When you see the problems that are prevailing, this is a regulatory mechanism that is there, right? So because you know why it is said regulatory, because it is very well mentioned here, it is a national regulator for the cosmetics pharmaceuticals, so regulatory dimensions and issues are there. Yesterday also we were dealing with about the issue with respect to the primary healthcare center, secondary healthcare center, tertiary healthcare center, and how the weakened primary healthcare center is basically aggravating the health issues. Now, this is at the back end, you see the regulatory aspects that are present there. So these are basically adding to the knowledge. Now, even knowing these dimensions, you will be able to analyze that so many problems are there in the health sector, right? So this was the editorial. Now let's move on to the next part. Now this is very, very important with respect to general studies also. Why it is important is, see, this article says over 70% child death in India are linked to malnutrition. Now, this is a very, very problematic scenario. See, certain facts that are mentioned over here. See, over here, what you need to do is, you need to know, okay, little bit facts, what are the scenario. You need to know what basically malnutrition is, or malnourishment or malnutrition is. Then obviously you need to have a little bit idea of what government schemes are also there in order to deal with this problem. So let's see. This article basically mentions that in 2021, 0.7 million children under 5 died. Out of this 0.5 million, 0.7 million, 0.5 million died due to child and maternal malnutrition. Now that is a very, very important concern that needs to be resolved. So this is a major, major problem. Now, when we are dealing with this particular topic, please remember that we have to understand what malnutrition also is. Clear? See, now in this article, one more thing that is very prominently said is that this particular high death scenario is more prevalent among the lower income groups. Now, when we see over here, obviously poverty is going to aggravate, let us say, non-availability of resources, possibly lack of employment opportunities, possibly not having the basic nutrition aspects that will or might lead to further aggravation. Right? There are various other social, economic, and political factors also. But what the articles deal is with the lower income groups and what the death scenario over here is. Now, let us again recall 0.7 million deaths in 2021 under 5, out of which 0.5 are related to the nutritional aspect. That is a shame also that India is facing such a problem. So now let us see what the malnutrition aspects are. See, the World Health Organization has given certain definitions, we need to understand them. The World Health Organization basically says malnutrition refers to the deficiencies, excesses or imbalances in person's intake or energy and the nutrients. Now, this is the official definition of World Health Organization. Please remember, World Health Organization includes obesity and overweight also as a malnutrition. This is something that you should put it in your minds very well. This can be asked in your prelims also as well as mains. They will put that lack of, let us say, nutrients, vitamins or minerals, and third would be obesity. So you'll be saying obesity, how can that be malnutrition? Because it is not the correct intake of food. The unbalanced diet is also a problematic situation, right? So that is why we have put obesity also. Let's come back there to this. This is malnutrition's definition. Now, malnutrition is basically of 3 categories or types according to World Health Organization. First, undernutrition. Second is micronutrients related malnourishment. And third is overweight, obesity, and the various non-communicable diseases. Now see, undernutrition according to the World Health Organization are of 3 types. First, wasting, which is low weight for the height. Let us say you have a particular height. According to the height, a certain amount of weight should be there. But if you are below that weight, then that is wasting. That is low weight for the particular height. Stunting, that is low height for an age. Let us say for a particular age, approximately according to the standards, let us say this should be a particular height. But if that height is lower in comparison to that particular age, then it is known as stunting. Third is underweight. Underweight basically means low weight for that particular age. Now, what does that mean? If you are having a particular weight which is much lower than that, but that proportionally should be according to a particular age, then that is known as underweight. Now, these are the 3 types of undernutrition that are prevalent over here. Now, next is micronutrients deficiency. You will be knowing that vitamins and minerals play a very, very important role with respect to the growth and development of a human body. very often what happens, you might be consuming, let us say, proteins, carbohydrates, fats, but you might be lacking the essential micronutrients. What happens, that is a hidden hunger also that is present or called very popularly by the World Health Organization, because this lack of vitamins and minerals will lead to certain growth and developmental dimensions, whether related to the physical or even the mental health issues. Next is overweight, obesity. Please remember that these obviously are due to an imbalanced diet that a person is consuming, and it will basically lead to obesity and various non-communicable diseases like diabetes also. So all these things come under the category of the broad category of malnutrition. This is something as aspirants you should be knowing. Next, see, there are certain government schemes that are present which basically will help you analyze that how the government is basically dealing with these things. Now we have the Poshan Abhiyan. This is a national nutrition mission which is aiming to have a malnutrition free India by 2022. Now we all know that because of COVID the targets have been delayed, but government still needs to work a lot along with the collective effort of various stakeholders and NGOs and people as a whole, because we know so many people are dying because of malnutrition. That is a major concern. Please remember, this is one thing that is visible. If you see, according to the among the tribals also, if you see, the Kaka committee reports very categorically states that large number of tribals are also having a very severe issue with respect to the malnourishment issues. Please understand, if I talk about the tribals in the previous article also yesterday we had seen, according to the Kaka committee, remember that close to 50.4% of the tribals are also subject to alcohol conditions. So that because of that, the money that they have is diverted to alcohol drinking and they are not able to feed themselves or the family. So various types of issues come here. It is not only an issue of merely availability, accessibility and affordability. It is also where the money is being diverted by the people. That also is a major concern. Next, midday meal scheme. It aims to improve the nutritional levels among the school children. Obviously, because the food is being offered to the children in the school, the attendance can also increase, the nutrition level can also increase. So it is a very holistic aspect in order to resolve the issue of the malnourishment. Next comes the National Food Security Act 2013, which basically provides the ration to 80 crore people. Now that is a very big number. That is a aim towards, let us say, resolving the issue of malnourishment in India. Next is Pradhan Mantri Matru Vandana Yojana. Over there, 6,000 rupees is transferred to the bank accounts of the pregnant women so that they can have a proper, not only the deficiency with respect to nutrition for the child as the mother can be resolved, but also aid in, let us say, proper facilities can be resolved by this dispersal of money. Next is again Integrated Child Development Services Scheme. Now this is a very holistic scheme dealing with the education, nutrition and the dimension holistically, so that an all-round development take place and which resolve the issues of the nutrition aspects as well. Now this is my Telegram account which you can use as a means where you can find this PDF itself. Now this was what from today's current affairs. Please note that we are going to cover the current affairs in detail. There would be many articles that you will be thinking that could have been covered more also. Remember, on Saturday we will have even a lengthy discussion with respect to current affairs, because there are sometimes topics that have to be dealt in more detail. Certain other topics with respect to, let us say, prelims also, certain other questions also we can discuss. We will be having a Saturday, even a longer discussion where current affairs would be dealt with certain articles that we will pick up from the other, from the newspapers of The Hindu, which we had read, let us say, or neglected during the whole week. So we can pick up those articles and put it in the Saturday discussion and deal it in a very comprehensive manner. So this is Harpreet Singh from PW OnlyIAS English. I hopefully you enjoyed this session and learned something. This is what is expected of you to analyze the various details and intricacies of the newspaper and learn from it, gain the knowledge and learn the ability to comprehend. So take care, God bless and Jai Hind.